Good afternoon and welcome to Angie Lauritsen, legislative candidate from District 36. Thank you, Angie, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers, Susan DeCamp and Danny DeLong. We also have with us Joyce Beck from Grand Island. It's also my privilege to have with us today AARP Nebraska's state president, Dave Holmquist. And Emily Wick is also joining us today to assist with some of the technical details for the program. As a reminder, this meeting is being recorded and will be shared with our AARP members across your district prior to the election. Angie, as we appreciate your taking the next 30 minutes of your time to meet and discuss issues of importance to the 50+ voter and their families in your district and across Nebraska. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. Angie, if you want to start us off by giving us a little background about yourself and your campaign in 5 minutes or less, that would be great. And once we've completed that, we'll move on into the questions. So with that, Angie, I'll turn it back to you.
Perfect. Well, my name is Angie Lauritsen, obviously a candidate for Legislative District 36. I'm a wife, a mom, and a small business owner. I actually was born at Offutt Air Force Base, so I grew up military, but I've lived in Nebraska for over 30 years. And we moved to Gretna 11 years ago yesterday. And when we moved to Gretna, we brought some little kids and a small business with us. And so I instantly got involved with the schools and with the chamber. And with that, I also started getting really involved with other groups in our community. One of those is Lift Up Sarpy County. We help families that are facing homelessness and food insecurity in the county. And I'm also the policy legislative chair for Survivors Rising, where we advocate for survivors of sexual assault, domestic violence, and human trafficking in the state. And so through that work, I've been working with law enforcement and with senators on bill drafting, working with opposition and pulling senators off the floor. So I've been paying attention to the legislature for the last, I've been doing it last 5 or 6 years. And so recently, just last year, we were redistrict. And so a district from Western and Central Nebraska moved to Southern Western Sarpy and a little bit of Douglas County. And so I knew how important it is to have senators down there that are willing to have conversations. And I knew that I just needed to raise my hand and serve our community again. Previously, I was elected to the Gretna City Council back in 2016. And so I've been really involved with a lot of different functions within our community and being a part of a lot of the planning. Our district is the fastest growing district in the state. And recently, I was looking at the data, and I would love to get more data from you and look for some help as far as the membership for our particular district. But I've been meeting with other organizations and recently learned that we have the highest population of kiddos that are under 6. We are sitting at 10% of our population is under 6. And within our Gretna School District, which obviously falls a little bit outside of LD 36, I also recently learned that we have 5,000 single family platted lots, which is a lot. Our district was the way that it was drawn. We have a lot of growth that will be happening within our district. And so obviously with my work with City Council, I had been working with developers and making sure that they're building, when they're building these new developments, that we're building diversified types of homes within each of those developments. So we can't always be building the $500,000 home. We need to be making sure that we are building more of a diversified housing. So a lot of the different developments that you see around Gretna and in our area is you'll find some of those little townhomes or villas is what we like to call them. So making sure that we change some of the ordinances so that we can have different side yard setbacks and different spacing between houses so that we can build more of those diversified housing. So I've been just really active in the community and doing a lot of that kind of work. So that's a little bit about me. So if you ever have any questions, please feel free to reach out to me anytime.
Perfect. That's wonderful, Angie. Thank you. We'll just move, just because of the time restraints, we're going to move quickly into the next section, which is on the questions. And prior to this, we provided you with a set of 3 issues containing 4 questions that pertain to the 50 plus in Nebraska. We are allotting about 5 minutes for each of those questions. So the first question that we have to present to you is on health, caregiving, and home and community-based services. And Susan DeCamp is going to address that. So go ahead, Susan.
Good afternoon, Angie. I had the opportunity to meet you at an event, so it's good to see you again. And though I'm not in your district, I am in the neighboring district, and I am just down the road from Gretna. So anyway, welcome. My question is on home and community-based services and health and caregiving. So home and community-based services, also known as HCBS, provides an array of services designed to assist individuals with daily activities that promotes independence to support them to age in place or delay institutional care. A family caregiver is any family member, friend, or acquaintance who cares for another person that is unable to live independently, and they often provide this care without pay. Telehealth services can be significant for older adults in rural areas or underserved communities in particular, while also providing support to family caregivers by reducing travel, wait times, and costs associated with in-person care. So we have 2 questions for you on this topic. The first question is, what will you do to support the 240,000 unpaid family caregivers in Nebraska through policies such as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket costs? And the second question is, what will you do to protect and or expand the home and community-based services program, particularly recruitment and retention of a sufficient workforce and adequate funding of the services that Nebraskans and their families rely on?
Well, thank you for the opportunity to come and speak and answer some of these questions for you guys today. I have a unique, just a unique story. My sister-in-law actually is a home health nurse, and so she works out of Hastings. And so I get to talk to her frequently and learn about some of the things that she sees and the challenges that she sees. And she was worked in the heart cath lab at Bryan in, it was in Kearney, but now she's doing home health and she completely loves that. But I also get to learn from her the experiences that she has. And I think it's very obvious that we have a lot of issues when it comes to this subject within the state. We've seen a lot of facilities that have closed down recently, and we are not able to, we haven't been protecting those facilities, especially in the rural communities within the state. And I think I think everyone wants to be able to age gracefully and be treated with respect when it comes to how they choose to live in their later years, or when they start to need more help or more assistance. So I believe that there should be a complete overhaul of how we are currently handling things within the state, and also being able to encourage individuals to be able to stay in their homes, because I think that's where they would want to be, but we haven't been demonstrating that on a state level. I know that federal law, there's been some where we're trying to provide more options when it comes to support services, telehealth, reimbursing the family members and stuff, but there's so much more that we should be doing. And I would be in complete support of any of those types of efforts and continuing those conversations to make sure that we can be more of an ally in that area. And I'm committed to doing the work for that. And when it comes to like nursing shortages, I know that we've been seeing it across the country, not only just within our state, but I think that we've seen incentive programs when it comes to helping, especially teachers. We've seen a lot of incentive programs when it comes to keeping and retaining some of our teachers. We've seen it with our jail system, that if you pay them more, then we're able to hire more and be able to keep those that we train and make sure that they stay on long term. I think that we need to work on different incentive programs when it comes to this too. And obviously being able to increase the provider rate is an obvious way in order to increase those wages and make sure that we are giving those healthcare providers the resources that they need to be successful. And we've also seen it with like med schools, training up doctors, but providing those incentives to keep those doctors within those communities. I know that when I was in Leadership Nebraska, we were out, I think it was in North Platte, and what that hospital is trying to do in order to keep and retain the individuals there. So like they're even building, the hospital is building homes for their doctors in order to be able to make sure that they can keep people there. So I think we need to get creative, but also just know that I would be an ally in having those conversations and being able to work to help in this area.
Great, thank you, Angie.
Thank you, Angie. Our second question now, you kind of went a little bit into this, but we were talking about aging in place at home. Joyce Beck is now going to address the question on nursing facility quality, where someone's actually living in a facility where it's being provided care. So Joyce, go ahead. No, Joyce is frozen. There she comes back in. I apologize, Angie.
No, it's fine.
There she is.
Joyce, can you hear us okay?
Yeah, I can hear you. I'm
Perfect.
back.
All right, you're up on question number 2, so go ahead.
So Angie, thank you so much for joining us today. My question is about nursing facility quality. So over 20,000 Nebraskans require care in nursing facilities or assisted living facilities. And as you mentioned, some of the facilities have closed their doors, and they cited reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs, and RNs by 2028 to meet Nebraska's care needs. Everyone, regardless of where they reside, deserve to be treated with dignity and respect and have access to quality medical care. Better staff to resident ratios improve the overall quality of care and well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across the long-term care services and support industry. Causes of workforce challenges must be identified and implemented to respond to the growing need for high-quality care. So my question, Angie, for you is, what would you do to improve the quality of nursing facility care for Nebraska residents, including addressing the growing long-term care workforce crisis in the state, professional education, and accountable facility reimbursement?
Thank you again for the question. Thank you, Joyce. Know that I'm an ally when it comes to, we see it with teacher-student ratios, and we also see it with in our foster care system. I know that when that ratio is being met, I know that all of those kiddos that are in our foster care system are being taken care of. The same applies here. I recently had grandparents that were, in the nursing home facilities and understanding the level of care that they need or needed, and making sure that those nurses and those staff have everything that they need. It's unique. My husband and I, we actually own our small businesses that we help corporations with their employee engagement and workplace culture. So people reach out to us all the time about how do we keep and retain our good talent. And, a big part of that is making sure that we're paying them what they deserve to be paid and for the work that they're doing. But there's also a lot of other things, from administrative all the way down to making sure that those employees know that they can be treated with dignity and respect, but also making sure that their clients, their patients are also being treated in the same way too. we last year, the unfortunate piece, I believe it was in 2020, the legislature through DHHS had $7 million that could have gone to nursing homes that was not spent. And so making sure that we are holding our executive level leaders accountable for that, to make sure that the funds that are allocated by the legislature are going to where they need to be going, and making sure that we are able to fully fund, hopefully get closer to fully funding these facilities. And so making sure that we have a legislature that's actually holding that executive level power leadership accountable for those funds that should have been allocated. Obviously, provider rates need to be higher so that we can increase pay and keep people in the field. But, it's super important that we have those facilities that families can stay close to where they grew up, and making sure that they don't leave their families, their friends, and their community only to be able to access the health care that they need. So making sure that we are providing that level of care so that people can age gracefully is obviously a priority of mine, and I will be an ally for you. And I think it's super important. I know we here in Gretna, what's super frustrating to me is these are numbers, the numbers that you're saying, these are numbers that we've known about for a long time, right? Like, we've been forecasting and we've been saying, we've been warning, like we have this aging population that's coming. We have decades of data where we can plan and be ready and have this workforce and have these facilities that we're going to need. But it seems like there's a lack of implementation of trying to provide those services that we're desperately going to need. And I have a new home that's being built just a mile north of me, and I know that it's only going to have like maybe 100 beds. Like, it's a Band-Aid, it feels like, and we can't build them fast enough. But also, who's going to work there? Making sure that we are working with our schools to make sure that we do have a pipeline of students that are going through, because I know that when you look at the nursing shortage that we have, they can only graduate, I can't remember what Nebraska Med or UNMC said, that they're graduating like 100 plus, every semester. And it just seems like it's not enough. Like, how do we get there? So, and I know that, and what a lot of people don't know is that I actually, in 2020, Nebraska Med put out a call for help during the pandemic. And so, I was like, I would do this work for free. I would volunteer to do that. But obviously during that time, they were not taking volunteers. So I did go to work at Nebraska Medicine, and I was a PPE extender during the pandemic, and at the height of the pandemic, and working in those ICU units at Nebraska Medicine. And my job was just to make sure all the staff had the PPE that they needed prior to going into those COVID rooms. And so, but we had the same snack area, we had the same lunch area. So there was one room where you can take your mask off and hang out, and everyone would be in there, and you'd be able to talk to all of them and be able to understand the struggles that they have. And a lot of it was travel nurses that were coming in and working to help fill the vacancies that we had. So how do we get our nursing pay so that they're not always having to travel in order to get that higher base of pay? How do we get them to settle in Omaha? How do we get them to settle in Nebraska? I think that's something that we really need to tackle and be open to talking about, and also be creative about how we're going to fix this problem, because using traditional methods, we're obviously not getting to where we need to be.
Mm-hmm. Thank you, Angie. I appreciate that answer.
Thank you. Our last question, Angie, or our final question for the series, is on addresses livable communities and helping people stay in their home. And Danny DeLong is going to take that. So Danny, I'll pitch that to you.
Hi, Angie. Glad you're with us today. Consistently, when AARP has polled people who are 50 years plus and asked them what is their priority moving forward, it is to age in place. in effect. I want to live in my home. I want to live in my community. I want to live where my friends and family are. And that's called aging in place. AARP takes that seriously, and we propose and continue to support the idea of what's called a livable community. Livable communities are safe and secure. They offer affordable housing and transportation options that allow individuals to travel by multiple means, and they provide supportive community features and services for people, such as access to healthcare and high-speed internet. That allows people to remain in their communities as they age. Affordable transit options and reliable healthcare are critical to support older Nebraskans aging in place. High-speed internet should be affordable, reliable, and accessible for all Nebraskans. Digital skills development, which we'd also call digital literacy, is also essential to obtaining the benefits of high-speed internet access in the home. My question for you is, what will you do to ensure all Nebraskans, mainly those 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet, including digital skills development?
Well, I get told all the time that I don't look old enough to have a 25-year-old. So I'm only a couple of years away from being eligible to be a member. So obviously this hits a little, this hits a little bit close to home. But working with and the expertise that I bring of working with so many different diverse things. So when we're talking about housing accessibility, we have, when you're building out apartments here in my area, before they're even built and completed, the first floor is automatically leased out a year before it's even completed. And it's all individuals, it's all those aging groups that want to downsize, get into a smaller home, but also take away, they don't want to do yard maintenance or shovel the driveway. They don't, they can deal without having some of those issues, but yet find something, be able to downsize so they can stay close to the grandkids. That's usually who's moving to our areas. They got the grandkids that are moving in, and they want to be able to stay close to home, but they also don't need this big giant home anymore. They want to stay close to the family. And so making sure that we're providing more of those types of housing options in all the different communities throughout Nebraska. So not just here, but everywhere. And what's super interesting is where we live and what my husband does, he's a keynote speaker. And so he speaks to thousands of people. We have to have incredibly reliable, high-speed internet. And so I live on the west side of Highway 631. And when I was on city council, I'd have people complaining all the time about, if you live in these different neighborhoods, your internet was constantly going down. And I was like, well, I live in Gretna too. Like, I don't understand how come ours is fine, but theirs isn't. But then it was that like, okay, ours is fine, theirs is not. We need to fix that. And so understanding that even just people that live across the highway have a much different internet connection speed than what we do, and being able to try to find fixes for that. And you have to be creative, when it comes to fixing that broadband, because while we're in Gretna, we're the fastest growing community within the state, we still have challenges too. So, and I've traveled the state, I know that there's many issues throughout the state that we need to get fixed. And so, one of the ideas I know that was floating out there is like, we're constantly rebuilding roads in our area. We're expanding road infrastructure in our area. And so an idea that is like, while you're tearing that up, why aren't we also laying down some fiber? That would also save time, and it would save some money while you're already tearing up this road and you're already moving all the utilities to that new right of way. Why are we not laying down more of that, the fiber now? So, it might get technology increases and that might become obsolete in the future, but right now, let's build that out. So just coming up with different creative ideas on how to try to fix that. But obviously with some of the federal money that's coming to Nebraska, what is it, $200 million that I think is coming. That's again, another Band-Aid on it because of how incredibly expensive it is to try to get more of that broadband infrastructure out to the rural areas within the state. Within Sarpy County, when we're talking about transportation, we've had to come up with some different creative, different ways to help with transportation. In Sarpy County, we really don't have any public transit. There's some that go down into Bellevue, but we don't have anything into Papillion, into Gretna, Springfield. We don't have anything like that. So trying to get more creative about what that looks like, using groups that currently already have drivers that are already driving around already, and trying to get them to handle some of those types of transportation of getting individuals from point A to point B, whatever that might look like. I know that we had a pilot program of using Uber and Lyft, which I know is not, all over the state, but even out here in rural Sarpy, we have Uber and Lyft drivers. And so maybe those fees can be subsidized through a program of some kind. I know Lyft at Sarpy County, we've helped with some of those types of things where we have some grant money that we can put towards helping to pay for some of that. So just getting really super creative about using people that are already driving and getting them connected with the people that really need that kind of support. A lot of drivers are only happening, if you think about bus drivers, right? Bus drivers for the schools, they're only between this time and this time in the mornings and the afternoons. Maybe we can get those same people to drive these smaller, shorter types of buses, be able to move other people around. Just get super creative and think outside the box when we're talking about transportation within those different communities throughout the state. I'm one that I'm not, if I'm ever told like, that's not how we do things, or this is how things are always been done, that's a red flag to me that says, maybe we should relook at this. It takes some fresh eyes. It takes people willing to work through a problem to come to a good solution that works for everyone. And so that's kind of how I, work through different problems. When I'm presented with a no answer, I want to know the why. Like, help me out. Like, what's the history? Why is there a no answer right now? Like, let's try to fix this. Because I know that there's solutions out there. We just have to get a little bit more creative and think outside the box. So I hope that answers your question.
Oh, it did. Thank you, Angie. Appreciate your detailed answer. Thank you.
And I echo that. Thank you, Angie. I appreciate your passion in answering those questions. We're coming to the end. We have about less than 5 minutes left in our 30 minutes. So I would like to offer you the remaining couple minutes to offer any closing thoughts or comments that you might have for our members and the constituents of your district. So I will pass it back to you for those final thoughts.
Awesome. Well, thank you again for the time. I really appreciate you and taking the time to learn about legislative races within the state. I know that Nebraska is unique when it comes to a unicameral, but I also know from my experience how incredibly important it is to have the right people that are down at the state capitol that's really working for the people of Nebraska and for our districts. Because I'm a small business owner, I can make my own schedule. This is my full-time job now. This is what I do. So I am out canvassing and talking to voters all of the time. Today, even my husband is traveling. And so I'm trying to figure out how to get one kid from one place to another, but yet fit in some canvassing time also. And then I got to cook some dinner. So it's when you still have, littler kids at home, my youngest is now 13, they can kind of take care of themselves, but also they can't drive themselves. So I still have to be that chauffeur mom. So being able to balance that and be able to work incredibly hard on this campaign is just the number one thing that I am doing. And so just know that I'll be an ally for you. My door is always open for anything. And I look forward to continuing the conversation.
Great. Thank you, Angie, again for your time. Thank you for visiting with us. We wish you the best with your campaign. And most importantly, thank you for meeting directly with AARP today. Take care.
Thank you.
Thank you, Angie.
Thanks, Angie.